Hello, everyone. Thank you for joining us today. Welcome to the Avexia webinar series. Our topic for today is how to get better clinical results with lab testing as a non-licensed practitioner, the do's and don'ts of lab testing in a nutrition practice.
My name is Christopher Chu. I am the Director of Marketing for Avexia Diagnostics and will be your host for this webinar. Today, I have the distinct pleasure of being joined by an exciting guest, Margaret Floyd Barry, who will be our presenter for this webinar. Margaret Floyd Barry is a functional nutritionist, writer, speaker, and educator in functional nutrition. Having seen family members suffer the devastating effects of chronic illness from a young age, helping others find a better way to optimal health has been her passion. Through the years of experience creating life-changing results with the most complex client cases, including reversing her own autoimmune condition, Margaret uses a powerful system for restoring health by addressing the root cause of the illness. Today, Margaret teaches fellow practitioners the same proven system she uses through Restorative Wellness Solutions, a 2-year comprehensive functional nutrition certification program for qualified health professionals. With over 1,200 alumni in 24 plus countries, Margaret and RWS teams are actively working to change the way health is delivered. Margaret is also the author of Eat Naked, Unprocessed, Unpolluted, and Undressed Eating for a Healthier, Sexier You, and Naked Foods Cookbook. Without further delay, I will now turn the webinar over to Ms. Barry.
Welcome, everybody, to how to get better clinical results with lab testing as a non-licensed practitioner. I am so excited to dive into the practicalities, the nuances, and considerations of working with these incredibly powerful tools in your nutrition practice. First, let me take a moment to introduce myself. I am Margaret Floyd Barry, Executive Director of Restorative Wellness Solutions, and we train health professionals, many of whom are non-licensed practitioners, in a powerful clinical toolkit and methodology to get exceptional results with their clients. And a big component of what we teach is how to work most effectively with lab testing. Now, I'm a non-licensed practitioner myself. I first graduated as a functional nutritional therapy practitioner from the Nutritional Therapy Association back in 2007 with an absolute fire in my belly for this work. I absolutely loved what I had learned from NTA, and I felt like I had been given the keys to the kingdom and could not wait to get out there and share this with the whole world. Now, fast forward a few years to 2013. And at the time, I was co-teaching with NTA founder Gray Graham and very seasoned practitioner Ann Fisher Silva, who was actually the co-author of the very first NTA curriculum. Both of these folks are absolute veterans in this work. And over dinner one night, Ann shared with me some of the additional tools she had layered onto her work as an FNTP. She had integrated all sorts of different lab tests and was getting these truly knock it out of the park results with her clients. Now, don't get me wrong, I did have a successful practice at this point, but there was this type of client that would absolutely confound me, right? That client who came to me eating a pristine diet, taking all the right supplements, doing all of the things, but who still felt like basically garbage. So I desperately wanted to help these clients, and I had no idea what to do with them. And Anne, well, on the other hand, was getting incredible results with exactly these kinds of clients. Now, she shared with me that she was thinking about creating a practitioner training to teach how she layered these tests, this objective lab data, onto the methodology that we already use as nutrition professionals to get such spectacular results. And I was all over it. I signed up for that very first training in the spring of 2014. And for the first time since graduating in 2007, I had that same feeling of kind of edge of my seat, can't believe what I'm hearing, experience of everything falling into place. Very quickly, I was getting the same kind of amazing clinical results as Anne was, even with those incredibly complex clients that used to mystify me. So the rest, as they say, is history. I joined Restorative Wellness Solutions as an instructor in 2015. I became partner in the company shortly after that. And then when Anne decided to pursue other ventures, I took over the business in 2022 and have made it my life's mission to equip as many practitioners as possible with these incredibly powerful tools. I firmly believe that the toolkit you have been trained with as a functional practitioner is one of the most powerful there is. When you add lab testing to this foundation, you'll be unstoppable. So I share all of this as context to say that we have now trained over 1,200 practitioners around the world, the vast majority of whom are non-licensed. And we've taught them how to work safely within their scope of practice as non-licensed practitioners with lab testing to get the same kind of exceptional results. So I come to you today sharing what I've learned over the years, both in my own practice and, of course, in training all these other practitioners who are in very similar shoes as you. Now, our outcomes for our time together today, first and foremost, is to understand how lab testing can help you get dramatically better clinical results, especially with those really tough clinical cases and challenging clients. Next, we're going to make sure that you learn how to work safely with lab testing in a way that's completely within your scope of practice as a non-licensed practitioner, also helping you avoid any kind of legal risk. Next, we will make sure you learn the different ways to access labs as a non-licensed practitioner, and then understand the best practices for working with labs to ensure that you are getting the absolute best results possible and avoiding common pitfalls that so many practitioners fall into. Now, before we get into the meat of this, I just want to share a really important legal disclaimer. So the information provided in this presentation does not and is absolutely not intended to constitute legal advice. Instead, all information, content, and materials presented are for general information purposes only. Information in this presentation may not constitute the most up-to-date legal or other information. Audience members, users, readers, anyone interacting with this information should contact their attorney to obtain advice with respect to any particular legal matter. No audience member, user, or reader of this presentation should act or refrain from acting on the basis of information in this presentation without first seeking legal advice from counsel in the relevant jurisdiction. Only your individual attorney can provide assurances that the information contained herein and your interpretation of it, importantly, is applicable or appropriate to your particular situation. So now that we have the legalities under our belt here, let's just talk about the historical context. We are in the middle of a real evolution and revolution in the world of health, from healthcare being primarily physician and clinician-led to a world where health is daily becoming more consumer-driven. In the conventional model, a medical provider oversees and leads an individual's healthcare plan, including determining what kind of testing is performed, whether that be for diagnostic purposes or to medically manage a health condition. Now, there has been a shift in this responsibility for health, away from it being the sole purview of the physician to being led and driven by the individuals themselves. So direct access testing, in which the consumer has direct access to ordering their own lab tests, is an essential feature of this shift to the individual taking that responsibility for and leading their own healthcare. While there has been a surge of popularity of direct access testing since the COVID pandemic popularized and normalized at-home testing, interest in consumer-driven testing is a concept that was actually introduced as far back as the 1950s, when over-the-counter urine glucose and ketone tests were first made available for diabetics to self-monitor glucose levels in an effort to decrease the incidence of complications. So this paved the way for development of direct access testing services for laboratory services overall, where an individual can order, pay for, and receive the results of lab testing directly without needing to go through a licensed health practitioner. Now, as consumer frustration with conventional medical system has grown alongside their appetite for control and for access to their own medical information, these services have become much more popular. It's a key element of the medical freedom movement. And so for us as nutrition professionals, direct access testing gives us an opportunity to gain a whole new layer of insight into our clients' health beyond symptom presentation alone. Having access to this information is definitely exciting and empowering. And we're going to talk at length about how to work with it safely and most effectively in a moment. But what is so critical to remember is that it is just one piece in a much bigger clinical puzzle. You need to remember this. The goal and purpose of any tool that you use in practice is to support your clients to get better results with their health as quickly and effectively as possible. There are a lot of different ways to do this. And yes, objective lab testing can be an absolutely invaluable piece of this puzzle, but it is not the only piece. And it's so important to remember that everything that you have learned to date, along with methodology you likely haven't yet even heard of, can play a significant role. Now, one of the things that we see happen a lot with practitioners who are new to using lab testing in their practice is that suddenly this shiny new tool overshadows all that came before. And this really should not be the case. It works alongside all the tools and information you already have, such as symptom presentation, food journals, detailed health histories, symptom burden analyses, such as the nutritional assessment questionnaire or other functional symptom burden analysis tools. And if you want to get the best results for your clients, you will always remember that bigger context and use the information that you glean from testing as an additional layer of information, not the most important or the only piece. We are always reminding our practitioners, when you work with labs, it's not about chasing numbers. This is about an additional tool to help your clients get well. So let's talk about why you would consider adding testing to your practice. And there are some very good reasons to do so. We think of objective lab tests as quote unquote looking under the hood, so to speak. It gives us another layer of information, objective information that can really help us to understand the root of what's going on. And as such, it really allows the practitioner to look beyond the symptoms to what's driving those symptoms. An example I like to use is a very simple and straightforward one. Let's say your client comes to you with constipation. Great, simple enough. Except we know there are many different underlying issues that could be leading to that constipation. Maybe it's poor digestive function. Is it hypochlorhydria? Maybe sluggish bile flow? Maybe insufficient digestive enzyme output? Maybe all three of these? Maybe it's some kind of dysbiosis, the microbiome might be out of balance, or maybe there's an overt overgrowth of something like a fungal infection or candida. Maybe there's H. pylori present. Maybe it's about food sensitivities. And if so, what foods is this individual sensitive to? It could be one of the usual suspects, as we like to call them. But what if a client is reacting to something that we think of as innocuous, like chicken or lettuce or avocado? Maybe it's a gut motility issue or a magnesium deficiency, or it could be related to mold exposure or hypothyroidism or. I think you get my point. You can see how something as seemingly simple as constipation can have so many different underlying drivers. And usually it's some combination of all of the above things I'm talking about. So in a case like this, do we want to rely on the symptom alone? Now, a detailed health history and symptom burden analysis alongside a food journal are absolutely going to help. And you're not just dealing, of course, with one symptom in isolation. You have far more information than that in front of you. So I don't want to discount that. But you're largely still dealing with the client's subjective experience, their memory, their ability to report accurately to you. So when you bring in lab testing, you're bringing in a layer of objective data that adds a whole new piece of information that you can work with. Another significant benefit of working with this objective lab data is that a lot of clients feel that objective data from a test is more reliable and trustworthy. I can remember distinctly a client of mine that I've been working with for years. She was a busy Hollywood executive director, super type A, never shut down, stress levels through the roof. And over the years, we had talked at length about her taking better care to mitigate these incredible stress levels. But it was honestly just something that she never prioritized. Now, when I added testing to my practice, we did a simple salivary adrenal test. And sure enough, her cortisol levels were incredibly low. Now, as I walked her through those test results, she looked at me and she says, Margaret, you've been telling me to watch my stress for years. My chiro has been saying this to me. My acupuncturist has been saying this to me. Basically, every practitioner she had been working with was telling her to keep an eye on her stress. And she says, seeing these numbers on a page feels totally different. I finally get it. And she did. From that point on, she made things like meditation and downtime, which I had been talking to her about for years. She made them finally a priority, all because of seeing objective lab results. Overall, testing allows you to be much more precise with your recommendations. And when you're more precise, you get clients better results faster, which ultimately saves them time and money, and of course leads to delighted clients. And delighted clients are your most valuable marketing asset. So from a business perspective, bringing in lab testing is a real strategic benefit, both for your clients' health and for your bottom line. So I think now we're all on the same page that adding lab testing can bring a huge benefit to you as a practitioner, and more importantly, to your clients. That said, as a non-licensed practitioner, it's really crucial that you understand how to safely use the information gleaned from these tests and do so well within your scope of practice as a non-licensed practitioner. So this question of how to do so safely and within your scope of practice is perhaps the most important question that we need to answer today. The Council of Holistic Health Educators developed a white paper to provide guidance to holistic health practitioners on the use of laboratory testing. This paragraph is the opening paragraph in their practitioner guidelines, and I'm just going to read it here for you. The Holistic Council is not aware of any regulations that prohibit holistic practitioners from engaging in the use and utilization of consumer-initiated lab testing. In consult with my own legal counsel, I have had many conversations at length about the legalities in this area. The reality is that this is an area that is not well legislated. He describes it as the Wild West. That said, this is important, it being unregulated does not mean that we operate without scrutiny. In fact, there are some who feel very strongly that non-licensed practitioners should not have any access to this information and that it should be declared firmly out of our scope of practice as nutrition professionals. In fact, ironically, the more successful we are with our clients, the more this can be perceived as a threat, the more we come under fire. Now, scrutiny does not limit our access to or our use of these tests, but it really does underscore the importance of us doing so in a highly responsible and professional manner in line with other regulations. This means it behooves us to make sure we know what we're doing, as we will be scrutinized more than a licensed medical professional using the exact same test. I can remember distinctly meeting a functional medicine doctor at a conference a year or two ago. Now, when she learned what I do for a living, she visibly recoiled and her whole demeanor changed. And I had a feeling I knew what she was reacting to, and not wanting to miss an opportunity to hear from a differing opinion, I asked her straight up. And she says to me, no offense, but I don't think nutritionists should have access to these tests. I've had many patients come to me who had worked with these quote unquote nutritionists, and they were a mess. Most had no idea what they're doing. Not missing a beat, I said right back to her, I know exactly what you mean. And that is exactly why I do what I do. And I will say I have had the exact same scenario where clients have come to me after having worked with multiple functional medical doctors, licensed medical professionals who have used these same tests, and we're also missing key elements of the clinical picture. So I firmly believe it's less about the designation and really more about proper training and really understanding how to work with these tests. We ended up having a really good conversation about this whole thing. She ended up learning about our course, referring some of her colleagues to it, which was wonderful. But really, I share this with you because it highlights something incredibly important. As non-licensed practitioners, working with labs puts us in a position of rubbing up against the edge of our scope of practice, and we will be under much more scrutiny than a licensed practitioner working with the same toolkit. This means that we need to be even more diligent and responsible in our use of these tools and make sure that we stay strictly within our own lane. The key risk is that we never, ever give anyone the ability to accuse us of practicing medicine without a license, something that is illegal in all states and varies from being considered a misdemeanor in some places to a felony offense with sentences ranging from 1 to 8 years in prison. So this is serious stuff. It is serious stuff, but it's also highly preventable. And one of the most important elements of preventing this in your language, or let me say that again, one of the most important elements to making sure you stay safe and that your clients are protected is to ensure that you are using the correct language and positioning of these tests in your practice so your clients know exactly how you're using them. Language really does matter. This is one of the most important elements when working with lab testing as a non-licensed practitioner. As you see here from the Holistic Council's white paper, this is another excerpt. If we claim to treat, cure, mitigate, or diagnose disease, this will be cause to declare that we are practicing medicine without a license. And the reality is that we are not treating, curing, mitigating, or diagnosing disease. It is very important that we do not use that language. So let's take a moment to look at the key differences between how we as non-licensed practitioners are using these tools and the language that explains it, and then how a licensed medical professional would be using these tests. A licensed practitioner has very specific training and a very specific role, which is to diagnose disease and then manage and treat that disease. They prescribe, and their primary toolkit is medication or medical procedures, such as surgery. They work with patients, and usually the work is about managing symptoms and managing disease. Also, this is a technicality, but it's important. They usually work within the insurance framework, which sets a very specific parameter for what is considered to be standard of care. Now, as non-licensed functional practitioners, we have a completely different approach. We are absolutely not looking to diagnose disease. What we are looking to do is identify imbalances in the body that, when they are corrected, can restore homeostasis, that beautiful state of balance that allows the body to heal. We never prescribe anything. We're making recommendations, and we're educating our clients about how best to use the tools that we, as nutrition professionals, are so well equipped to use, which are diet, supplements, and lifestyle. Now, when the people we work with are considered clients rather than simply managing disease and symptoms, we're really addressing the root cause of their issue and thus supporting the body to heal from the inside out. And unlike a licensed medical doctor, we don't work within the insurance system. Now, before anyone can say, oh, Margaret, this is just semantics, it's all the same thing. You're just not saying diagnosis or treat, but that's basically what you're doing. It is critical to understand that that is absolutely not the case. Language is critically important, but this is not just semantics. What we are doing is using the information provided by these tests as clues to identify imbalances in the body that can be corrected by our tools of diet, of supplements, and lifestyle changes to allow the body to then heal from from the inside out. This is an entirely different paradigm than conventional medicine. In this paradigm, not only are we not making a diagnosis in some ways is beside the point. If a client comes to us with a medical diagnosis that is very interesting, it's something to note as far as their overall clinical picture. But what is far more pertinent to our work as nutrition professionals is to understand the conditions that allowed the body to get so out of balance that a diagnosis was given. Our work is to unpack those underlying conditions, and lab testing gives us really important clues as to how to do this work most effectively. The diagnosis is not the point. Ultimately, as nutrition professionals, as non-licensed practitioners, the top two questions we need to be asking are, first, what is blocking my client's body from being able to heal? For example, is there a pathogen that's draining the immune system? Is there a high burden of toxins that's preventing the body from healing? And next, what imbalances in the body need to be corrected in order to restore homeostasis? Is there a nutrient deficiency, for example, some kind of hormone imbalance? Is the body too chronically inflamed? And if so, what is causing that inflammation or inhibiting the body from resolving the inflammatory process? We know that the body has a powerful innate healing mechanism. And if there is some form of dis-ease, then something's getting in the way of that healing. The information we glean from lab testing allows us to answer these questions much more effectively and support our clients in a far more targeted way to correct those imbalances and remove those blocking factors so that the body can do what it does best, which is to heal. So now let's talk about some of the logistics. One of the questions we get asked most frequently in some variation of, are you qualified to order labs for your clients? How do you do this? And the short answer is, as non-licensed practitioners, we aren't. But that doesn't mean you can't access them and glean the valuable information that they provide. There is a really common misunderstanding that access to the labs is the piece that's so challenging. And the reality is that anyone, you or your clients, can order just about any lab test. Many labs now market directly to the consumer, and others work through direct access sites that allow anyone to set up accounts and order labs. The key is not about access to this information. It's about knowing what to do with it. But we're going to talk more about that in a few minutes. First, let's talk about the different ways to access lab testing for your clients as a non-licensed practitioner. There are 4 different ways for you and your client to do this. First is that the client requests testing from their medical provider. Next is that the practitioner opens accounts with individual lab companies that permit and have medical directors on staff and permit non-licensed practitioners to open those accounts. The third is the client orders directly themselves via direct access testing services. And the fourth is that practitioners order on a client's behalf via direct access testing services. Now, these seem very straightforward, but all of them have their pros and their cons. So let's go through each of them so that we can determine which makes the most sense and when you would use that strategy. Now, the first is where the client requests testing from their medical provider. And in this case, the biggest benefit is that you're not in the picture at all. Although, honestly, this can be a downside too, as we're going to see in a moment. Sometimes this also means that insurance will cover the cost of the test, although I will say proceed with caution here. The downside of this scenario is that oftentimes the medical provider won't order the tests that we want to see. This could be for any number of reasons. Sometimes they just disagree with us that this test is going to be helpful. Remember that we are working from a totally different paradigm. So they can easily dismiss the tests that we want to use because they're not officially diagnostic in nature, but that's exactly why we want to use them. Sometimes they'll order a similar test, but it doesn't have all the information you want or need because they don't use the same test as we would use. Sometimes they're limited by insurance, the very benefit that I mentioned above. Now, I want to take a moment to talk about the insurance piece of this because it's really important to understand why medical doctors are resistant to requesting certain labs and getting insurance involved. Sometimes I hear folks in the functional space dismiss medical doctors and assume that it's some sort of hostility or conceit, and that's the reason why they don't want to order these tests or specific markers. I really need you to remember that if insurance is involved, insurance works entirely on standard of care. So if something is outside of standard of care, insurance won't cover it. Or if they do cover it, they often do audits of medical practices. I've seen this happen on a number of cases where insurance in an audit retroactively determines that a particular lab or marker wasn't warranted in a certain situation. And then it's the doctor who's on the hook for that payment. They don't go back to the client or the patient. And certainly the insurance company is deciding that they're not going to pay for it because of this decision. So it's the doctor who's on the hook for paying that. And this can quickly lead to tens of thousands of dollars in back pay. And I will share that a personal friend of mine who is in the functional space and put things through insurance was on the hook for over $90,000 at one point. And that was for just 1 year. So we're talking about real expense. Now, another piece of this is that most of the labs we would want to work with are firmly outside of the medical standard of care. And that's not a bad thing. That's actually part of their power. But it explains why a medical doctor who works with insurance is reluctant to order these tests. Now, one more point on this, and this last point that I mentioned, that the cost can be significantly higher to the client. When we're working with direct access testing, which we're going to talk through in a moment, we often get practitioner pricing, which is far, far lower than the market rate or what isn't charged if insurance gets involved. Okay. Years ago, I had a client who was insistent that his doctor order labs because he wanted it to go through insurance. And he was just so delighted when we decided to do SIBO testing because this was something that he could order through his doctor and put through insurance. So he did exactly that. And the copay for that test, the copay was $1,200. He could have ordered that very same test, the exact same test, and done it directly for me through a direct access testing service for less than $150. So I share this so that this story can now be your story when you're having conversations with your clients and they are wanting to put things through insurance. You can share this very real example with them. Now, the next way to access testing is to open accounts with individual labs yourself. And this can be a great way to go. You'll typically get access to the lowest possible price for the test. And often, if they're set up to support a non-licensed practitioner, then they will have medical team on staff for you to ask questions of. Now, the downside to this approach is mainly logistical. You'll spend a bunch of time managing multiple accounts with multiple labs. That's actually not that big a deal. What is more problematic is that there are a lot of excellent labs that do not allow non-licensed practitioners to open accounts directly. This is where the beauty of direct access testing comes in. With direct access testing, you can either have your client order the test directly, or you can open up a practitioner account and order it on the client's behalf. Now, the benefit of this option here, where the client orders their own tests directly, is that once again, you are completely removed from the process of ordering the tests. The downside of this option is that the client will receive the information from the lab directly. And this doesn't sound like a big deal, but what most clients don't understand is what the results mean. And when they get those tests back, they can, and they do, trust me from experience, completely freak out and start madly searching Dr. Google and going down all sorts of rabbit holes of panic. I have had to calm many clients in this scenario and reassure them that all is well. And certainly creating false alarm and panic like this is not what we're wanting to do with our clients. Another downside of this approach is that sometimes it's a little more expensive for the client, since there's usually some sort of upcharge for the labs when they're selling directly to the customer rather than going through a practitioner at practitioner rates. And for those who are jumping already into the business end of things, no, we don't recommend upcharging labs. It's illegal in some states, and overall, we don't consider it good practice. Now, the last option is our favorite option, and it's where the practitioner opens an account with a direct access testing service and then orders the client's tests on their behalf. And since you are watching this through Evexia, we will assume that you love this option too, because Evexia is by far our favorite direct access service. So the benefits of this option are many. For one, this way you're going to ensure you are getting exactly the test that you want. From a logistical standpoint, you have one central location for multiple different tests, and any direct access testing service will provide medical oversight on your behalf. It's also the lowest cost option for the client. Now, really, the only downside of this is simply that there is no one direct access service that has all of the tests that you might want to use. Avexia has a ton, and I know they're adding more and more every day. And I don't know that any one single company has everything yet. So, the reality is that over time, you're likely going to end up using all of these methods for accessing tests. As I've said, you are a client of Avexia Diagnostics, which is by far our favorite direct access testing resource. So you have a plethora of outstanding tests at your fingertips. That said, there will be times that your client's able to get the tests you'd like to see from their doctor. Other times you'll need to open up accounts with specific labs. As I said, while Avexia has accounts with many outstanding labs, it doesn't have access to every lab that exists. In some cases, your clients will go directly to a direct access testing service and get the test for themselves. This often happens when they come to you with labs already in hand. And as I've shared over and over now, our favorite way to do it is by doing what you've already done here with Avexia, which is to open a practitioner account with their direct access testing service, which allows you as a non-licensed practitioner access to many different labs, many of which are only available to licensed practitioners. But with the oversight from their medical team, you're given access to this to order on behalf of your clients. Now, a couple of important exceptions. There are certain states where direct access testing is either largely unavailable or quite limited. New York, New Jersey, and Rhode Island all have very different and strict requirements. Now, different testing companies have different requirements and options. So if you live in one of these states, I would recommend strongly that you check directly with the lab or the direct access testing company to determine your options. Now, this is all great, and as we've said, access to the labs is not the issue. It's what you do with them that counts. So let's look at some best practices for working with labs as a non-licensed practitioner. First and foremost, you want to ensure that you are very clear about why and how you work with labs with your clients. You want to do this both in any written communication as well as anything you say to them verbally. You want to very clearly explain the difference between how you use these tests, which is that you're looking for imbalances that can be corrected via dietary and nutritional strategies, and then explicitly outline how you are not using these tests to diagnose or treat anything. It is very good practice to say both out loud and in written form, I am not using these tests to diagnose or treat anything. That is outside my scope of practice. This shows your client your clarity on this matter. Now, of course, you will also want to explain why you use this testing. It's not just an excuse to spend more of your client's money, not at all. If anything, in the long term, you are going to save them a lot of money and pain. It's providing invaluable additional insight that can allow you as the practitioner to get to the heart of the matter faster and make even more targeted and helpful dietary and supplement recommendations. Now, you need to ensure that you include testing in your disclaimer. And I'm going to read this again straight out of the Holistic Council's white paper. Practitioners need to ensure their clients understand that holistic practitioners, practices, and even the use of testing is not medical treatment, and that holistic practitioners are not licensed medical providers. So a key disclaimer is a key vehicle for this. Using a disclaimer is absolutely essential no matter what in your nutrition practice, whether or not you're working with labs. It's critical that you explicitly state that the use of testing is not for medical diagnosis or treatment. Explain that you are not a licensed medical provider and that anything you share related to the test results is simply educational, not diagnostic. In my practice, I have a lot of initial paperwork. We've got the health history, food journal, symptom burden analysis, some other bits and bobs. Of all of this, the only thing that is absolutely essential for the client to fill out is the disclaimer. I'll see a client if they haven't filled out any of the other forms, but I will stop a session outright, have them go sign the disclaimer form if that is all they do before we can proceed. Now, in addition to a global disclaimer, it's also very good practice to include a written disclaimer whenever you're sharing any information pertaining to a lab test, even when you're simply explaining logistics about specimen collection or test kit shipments, anything pertaining to the test. Have a short disclaimer that you have, quote unquote, at the ready. When discussing labs with your clients, you always want to say your disclaimer verbally and explicitly. Now, it doesn't have to be complicated, but it does have to be explicit. And it should be related and restated every single time that topic of labs comes up. So the Holistic Council includes guidelines of what should be included in a disclaimer pertaining to lab tests. And this content is directly from their white paper. The details of your disclaimer really ultimately will depend on your foundational training. So we recommend that you reach out to the institution with which you did that original training for their disclaimer forms, and then ensure all of these bullets that are on this slide, you can take a screenshot, or which is probably the best thing, take a screenshot so you have this information. Make sure all of these bullets are addressed as well if you decide to add lab testing to your practice. Now, one of the things that happens all the time with clients is that even though you have been very clear in your language, both written and verbal, they sometimes get confused and they use medical terms because that's what they're familiar with. They, for example, you will recommend a supplement protocol, and the next time you speak with them, they'll ask about the medications you prescribed. Big, big red flag. Now, what you can do here and what you should do here is to gently but very clearly remind them that these are not medications and that you did not prescribe them. They are supplements that you recommended. Yeah, you can be fun with it, but you can also be explicit and really clear, and never let a misunderstanding like this slip, because if they're saying it to you, they are definitely saying it to others. Now, to this point, you will want to ensure that you scrutinize all public-facing materials for anything that could be construed as a health claim. This includes client comments, even on social media. You know, if you have a client who uses medical language regarding your work together in a public space, your job is to gently but clearly and publicly correct them so that there is no confusion and you are clear on your messaging. In general, I recommend you don't mention lab testing overtly on your website, or at least don't make it a key point. I work extensively with labs in my practice, and you will barely find mention of this on my services page. What is important to your client isn't the tool or methodology that you're using. What's important to them is the transformation that you are going to help them achieve. And I know I'm slipping into marketing here, but sometimes we see practitioners we'll see them highlight the tools they're using rather than the transformation. And clients are coming to you for the tools. They're coming for the change in their health. So speak to that more than the specific approach. And not only will your marketing be more effective, there will be less to publicly scrutinize when it comes to testing. Another business basic and essential is to ensure that you have professional liability insurance in place. I always say that now that you have your core training and resources under your belt, the only thing you need to have in place before you start accepting paid clients is a way to accept money and liability insurance. Your website can wait, branding can wait, Instagram can wait, all of it can wait, but you absolutely need to have that professional liability insurance before you start. It's worth absolutely every penny, and hopefully you will never have to draw on it. Now, maintaining your client's confidentiality and privacy is always a very good idea, but when you add lab testing to the mix, it becomes even more important. You'll want to ensure that the platform and communications maintain your client's confidentiality. Unless you're very tech savvy, the easiest way to do this is to use a HIPAA-compliant practice management service like Practice Better or Biocanic, both of which will integrate into Avexia to make this really easy for you. And they will make sure that HIPAA compliance is all there for you. There are a lot of benefits beyond the privacy benefits to using these services, but a nice bonus is that they're HIPAA compliant, so you just don't need to think about it. Even though as non-licensed practitioners, we aren't required formally to be HIPAA compliant, it very much is best practice to act as if. And if you consider that we're likely under more scrutiny as non-licensed practitioners, taking these extra steps only increases our professionalism and our credibility overall. Now, our work does not in any way replace medical care for your clients. And done right, it can work beautifully alongside it. First and foremost, you want to help your clients understand the difference in paradigm. And as we've already discussed, you want to be able to explain very clearly how you use the information from lab tests and how this is different from the way a medical professional will use these tests. There will be nuances of difference depending on what test we're referring to, but the overarching message is, I don't use these tests to diagnose or treat anything. That's outside my scope of practice. I use the information from these tests to help identify imbalances that we can correct with the strategic use of diet and targeted nutritional therapy. From there, it's going to depend to a certain degree on the test. And it's a very good idea to understand how the medical community uses and or perceives a test and how this differs from how we use it. So let me give you some examples here. We use the GI map stool test from Diagnostic Solutions as our preferred stool test. And in the medical community, they use stool testing to diagnose acute digestive distress. And they are looking for a set of overt pathogens that can cause acute symptoms. The GI map is not a test they would use for that. And frankly, many medical practitioners would scoff at it. And one of the criticisms of this test is that it's too sensitive and that much of it is not diagnostic, which is exactly the reason we like it. We aren't looking to diagnose pathology. We are looking for imbalances. For example, in the microbiome, there can be imbalances where opportunistic species are overgrowing. And while this might not lead to a clinical diagnosis, it can certainly and significantly contribute to digestive symptoms. So this information can be absolutely invaluable to us in knowing how to bring the system back in balance so that those symptoms resolve. Another example is when you are using blood work. And this is one of those times where it's particularly important to explain the difference between our approach and the medical approach, since this same type of test is used commonly for diagnostic purposes in a medical context. Explaining the difference between lab ranges and functional ranges, for example, and explaining that what we're looking at this information from a totally different perspective and not to diagnose is absolutely essential in all of our client communications. And this brings us to a very important point. When you're working with lab testing, occasionally you're going to come across markers that are significantly out of range and warrant medical attention. Part of your responsibility when working with this information is to know when it's appropriate to refer your client out for medical care. If in doubt, always proceed with caution and suggest both in writing and verbally that they share their results with their primary care physician. For example, we always recommend that our clients share the results of any lab we've recommended with their primary medical practitioner so that they can look at it from that medical perspective. Now, we could do an entire training on working with medical professionals. We know that some are more open to our paradigm than others, and it's both an art and a science in and of itself to establish a productive collaborative relationship with medical professionals and to do so in a way that doesn't put your client squarely in the middle of conflicting perspectives while also allowing for multiple viewpoints and approaches. So this is an important piece, and we're not going to be able to go through all of that today, but I really want you to be thinking about how you can do so most effectively. Now I come to one of our last points. This is last, but it is certainly not least. I have said multiple times today that access to testing isn't what's most important. Anyone can access testing. What is most critical and what will all be scrutinized for is what we do with these tests. So this means that learning how to most effectively use the information gleaned from objective lab testing is absolutely integral to your success and your safety in using these powerful tools. My husband is a chef, and there is a saying in the field that the best chef's knives do not make the chef. And this is very much the case when it comes to working with labs. There are some tests that are fairly intuitive. So working with a micronutrient panel, for example, and with your training in an extra webinar or two, you've already got what you need to work with results from a test like this. But with direct access testing, you have access to a whole array of tests and tools, some that are very much wellness focused and widely available, like CGMs and Oura rings and other wearables. But you also have access to comprehensive blood work that is medically used for diagnostic purposes. So understanding the nuances of these tests and how to work with them from that functional perspective is absolutely essential. Remember what we started with. As non-licensed practitioners, we are, like it or not, under extra scrutiny in this area. So this is our reality, whether we want it to be that or not. These are powerful tools, and if we use them incorrectly, they can do harm. So it is our absolute responsibility to understand what we are seeking, what we're seeing when we are looking at these labs. And we need to know how to work with the data most effectively so that we can truly unlock the power of this information to get the most benefit for your clients. So a great next step and resource for further training is, of course, our training program, which is Restorative Wellness Solutions Program. Our entry-level course is Mastering the Art and Science of Gastrointestinal Healing. And I'll share with you that in our experience, we've talked a couple of times about the GI map. I've given that as examples. A lot of practitioners don't truly understand the nuances of the GI map and how to properly pair it with food sensitivity testing to get truly outstanding results, even in those clients who don't have overt digestive symptoms and whose health issues seem to be, at face value, unrelated to gut health. Learning how to work with the data from a GI map or any other stool test and how to really fine-tune your protocols and recommendations is an essential ingredient in all of this. Now, I am not going to spend too much time on this, but just to say that if you are interested in really honing your clinical skills, really understanding how to work with tests, we start in this first program, we start with the GI map, a couple of other stool tests, as well as SIBO testing and some food sensitivity testing. That's what we cover in this first class. Then we have other subsequent classes that dive into hormone testing, a very deep dive into blood chemistry. Our capstone course, we go into genetics and autoimmune complications, neurological considerations, and very deep detoxification. So very, very robust overall curriculum. And if you are a non-licensed practitioner, and if you want to make sure that you are doing this safely and that you're getting your clients the best possible results, I strongly encourage you to check out our program and consider joining us. Our next cohort starts soon on September 3rd. Our registration is now open. You can see the links in here. Now I will just quickly, I think the best way to share about this program is just to tell you of one of our most recent alumni who is a registered dietitian. So she actually is licensed, and she has been in the field for 25 years. She's attended all sorts of trainings, intensive seminars, and so on. In fact, she wanted to just jump into our blood chemistry class because she's been working with the GI map for years. In fact, she also teaches how to work with some of the food sensitivity testing that we teach. So she thought she had this all covered. And we teach a very specific methodology. So I required her to start here, and then she can do the blood chemistry next, which she's enrolled in for the fall. And a few weeks into class, I got a text message from her saying how completely blown away she was by the curriculum, how in-depth it was, how much more comprehensive, and really not just teaching you how to interpret the results, but teaching you what to then do with that information to get your client well. And I took that in knowing that this is somebody who has already been working with this. So if somebody like her can get such great results, think about what it can do for you. Now, all of our classes are in cohorts. It's virtual online, but they're in live cohorts. So our next cohort starts September 5th. We have, if you're watching this later, we have cohorts that start twice a year, September and then in March. And we have the core training modules all live online. We have a lot of one-on-one and live access. So this is not one of those classes where we just throw you in and wish you good luck. You have live Q&A webinars every week, as well as 2 live open office hours from the instructors where they hop on Zoom and are just there informally to answer your questions. You get to develop relationships with others in your cohort. You also have a one-on-one instructor who is designated to you and kind of keeping an eye on your progress, grading your quizzes and homework. There's a very, very robust course. What I will say about it is not the kind of class where you have a webinar on in the background while you're doing the dishes. It's something that's going to require your full attention. And as a result, it's very valuable for your practice. I'll just share a little bit about how we're different. This curriculum goes a lot deeper than any other program out there. It's both for non-licensed as well as licensed practitioners, but we're really focusing on how we can use the information from these tests from this perspective that I've been talking about today. So as a non-licensed practitioner, this is where you want to be. We're also not tied to any one brand of supplement or lab. We're very agnostic, brand agnostic. We use what works. So you're going to see that reflected throughout everything we do. There's tons, as I said, of hands-on support. We also include a ton of business building bonuses, which are so important because, as I always say, training you to do the clinical stuff, if you are not actually out there using it with your clients, then we have failed. So we really want to support you in any way we can to actually use this from a business perspective. And something that's very different with us is that we provide ongoing access to our curriculum with updates over the time. So that's a big, big bonus, because let me tell you, these labs change all the time. So just a couple of quotes from some of our alumni. I really just want to reiterate that when leveraged right and used appropriately, safely within your scope of practice, they can absolutely transform your practice. We see this time and time again, and we would love this to be your success story as well. So I'll just pop this slide up again. Thank you so much. Whoopsies. I'll pop this slide. There we go. You have the link and the QR code. We would love to see you in our class in the fall. Thank you so much for joining me today, and I hope to see you in the fall. Take care.
Thank you, Ms. Barry, for this informative presentation. Thank you all again for joining us for this webinar event. Until next time, from everyone at Avexia Diagnostics, stay healthy, stay safe, and we wish you all the best on your pathway to wellness.